people who died because of the Spanish flu is actually more than the number of people who lost their lives in both World War I and World War II put together. And because this affected a lot of young people, there was a phenomenal strain on the society, and it is believed that for several years, up to a decade after the pandemic, it still had impact on schooling, on jobs, on the health effects which it had caused on people. So that is one spectrum of the flu. That was a very serious pandemic. But we still have the flu. Every year it affects millions of people. It is believed that at least 5 million people suffer with flu every year, and probably many more who may have a subclinical infection. The flu typically causes a sudden onset of body pain, a little bit of a runny nose, cold-like symptoms, scratchy throat, and this is followed by fever, quite often 101, 102 with a lot of pain. Patient is really poorly for 2-3 days. Then the fever improves and settles, but the person may be left with a very bad cough and tiredness, which may persist for several days and sometimes even weeks. So this is how a typical flu presents. Now this has to be differentiated from the cold. The cold typically causes a runny nose, a stuffy nose, a little heavy head. You feel feverish. Temperature rarely crosses 99.5. So the presence of a significant fever and severe body pain is the main factor which distinguishes a flu from a common cold. Common cold is usually trivial. You are down for a couple of days and then you are back to normal, whereas the flu can even kill. Anybody can get the flu, but if flu affects young children less than 5 years, if it affects people over the age of 65, or people with other what we call as comorbidities, people with diabetes, hypertension, heart disease, lung disease, kidney disease, this can cause a severe pneumonia, just like the COVID. When you get a pneumonia, it can lead to hospitalization, ICU care, ventilation, and even death. So young children, elderly people, people with comorbidities can have complicated flu pneumonia, which can even lead to death. So when we read in the papers, 2 people die of flu, it can happen. It is not unusual. It is only the fact that we are picking it up better now, and this is the reason I think everybody should be careful how you treat the flu, how you react to the flu, and what you do to prevent yourself from the flu. Do I stop here?
So,
now this flu is, as she mentioned, reasonably preventable. It is not something which we have to go through because it is flying around. There are 2 or 3 things I would like to highlight. One, especially if you have the symptoms, if you have the fever, the cough, or you're feeling really lousy, runny nose, coughing, sneezing, please stay at home. When you have these symptoms and go and work, especially in a gathering like this, and you cough, you speak, you breathe, you can transmit the flu. And the flu is similar to COVID, which is through the respiratory droplets. So if you cough, the virus attaches to the small phlegm which comes out from your mouth and nose and drops to about 3 to 6 feet near you. So anybody in this vicinity can pick it up directly, or if you cough or sneeze and the secretions fall here and somebody touches it and takes to their nose, they can get it. This is very similar to COVID. So one, if you have the illness, please do not go and spread the cheer. 2, especially when flu is around, keep your hands to yourself. Do not touch your face, do not touch your eyes, do not scratch your face, do not touch any object which may have been contaminated. Take your hands near your face. That is how you get. So these are the 2 fundamental principles. But the more important issue is to understand that there is a vaccine for flu which can prevent to a significant extent both flu and its complications. So this flu vaccine is available every year, depending on what is the type of flu strain which is circulating in the world. Now, flu virus is notorious for undergoing changes, what we call as mutation. Mutation is a change in the gene, the genetic component of the virus. This keeps changing every few months. So what circulated last year may be completely different from what is circulating this year, or what may circulate 2 years down the road. So depending on what the circulating strain of the virus is, the World Health Organization has surveillance centers which collect data in the northern hemisphere and in the southern hemisphere. And based on this data, they will inform the vaccine manufacturers the likely strain which is going to circulate in the next 6 months. And based on that, the vaccine is produced every year. So every year the vaccine strain may be different, and by taking the flu vaccine, we protect ourselves from what likely flu strain circulates that year, thus preventing probably not only the flu, more importantly, the complications of flu.
And if infected, it can lead to complications and hospitalization. What I have to share with you is about what is the evidence suggesting about influenza and its implication. It clearly shows that if I take a high-risk population, which doctor just defined, that typically elderly patients more than 65 years of age, patients with comorbid conditions, can I stand? With comorbid conditions like diabetes, cardiovascular diseases, chronic kidney disease, pulmonary disease like asthma and COPD. If these patients are vaccinated with influenza vaccine, there's a 50% less chance of hospitalization if they are infected with influenza. So that is a protection what a vaccine can offer to this high-risk population. Now coming to children less than 5 years, we always advocate that children less than 5 years should be taken the influenza vaccine. It has been seen that if these children are vaccinated, there's a 57% reduction in the risk of hospitalization if they are infected with influenza. To speak about influenza complications and preventive measures, we had started a campaign called as My Mothers Against Influenza campaign somewhere in 2017. We do it every year where we go to pregnant women, we address them and we tell them the importance of vaccination. It will prevent them as well as for their babies to be born. So this is the campaign which we are doing year on year since 2017. We are also very active when it comes to the media, whether it's the print or the radio, as well as the social media, where we do speak about influenza and the burden and how do we prevent all these particular causes. Last year, we had a special campaign for the school-going children. Before the academic year started in the month of June, we schools in major metros address the parents of the school-going children, telling them about the importance of vaccination. So these are some of the ways by which we are able to go to the community, either to the public or to the doctors, and spread awareness about influenza.